inputs, you take inputs from as many sources as possible. You talk to the nursing staff, you talk to the other residents, you talk to the other faculty members, even before you start any appraisal of any student for that matter. My worry mainly is about for how long the residents are going to stay according to this program now. Out of 36 months, they will be working with you only for 18 months. The remaining time they'll be spending in other areas. So I am not very sure whether your 18 months appraisal is going to be really effective. I know that the other people, wherever they go, the appraisals are not going to be quite informative or really very objective. Everybody will write, as Dr. Shah said, very good, or fair, or can improve like this. Those comments are not going to really help us. So I feel that even for that 18 months assessment, which we are going to do of these students in our own department, that should be more realistic, more objective, and maybe we should gather as much of information as possible. The other important thing which I liked about this appraisal form is the last column, where he says that the issues have been discussed with the candidate or not. That's a very good idea, because always we have to there and then itself discuss with the PG student whether whatever they're doing is right or not. If they are not right, where they are going wrong. And that discussion is going to really give a lot of inputs for the candidate so that he can improve. Based on that, he can probably make a better candidate during the examination time. So these are some of the comments on the appraisal form, but I'm afraid that unless you are really devoted, you cannot really do proper assessment, even if the instrument is good. So the will to do it properly and your sort of sincerity in carrying it out, that's very, very important. Unless all professors realize this fact, all the faculty realizes this fact, maybe we are not going to achieve much out of it. This is my personal opinion. Thank you.
Thank you so much, sir. I think that's another key recommendation from today's discussion, that having multiple assessors and also the comment section at the end of the form is very essential and could make the appraisal process more balanced and reliable. Thank you so much, sir, for your insightful thoughts. May I now invite Dr. Naresh Nimnani, sir. Sir, as a faculty member at AIMS, where structured academics and competency-based training have long been emphasized, what practices or lessons do you think other departments can adopt while implementing this appraisal form?
Yeah, good evening. Thank you very much. Hope I'm audible and visible. Though the network is unstable, I'm also out of town. In this direction, as the thread is continued from Dr. Kishore to Thinal ma'am and then sir, basically, since we are not directly under NMC, but we are following a part of that, we are under AIMS Act. But even under the AIMS Act, also the various the practices are going on in different institutions. There's no homogeneity. So for example, we have a serial assessments every 6 months, clinical separate, psychotherapy separate, and their exams, practical and theory is also separate every 6 months. Based on that, the assessment is compiled. But again, it is not the practice in all the AIMS and even in our place, not in all the departments. Two, when we were talking about the assessment, I was thinking various ways in the diagonal way. What about the PG training? Here we are talking about assessment, but do we have optimum training across India? Which is big answer is no. And when Dr. Kishore is leading the faculty development, then definitely, as Sinal ma'am said, the later part, the remediation. So then again, PG development forum should also be active. That too in the regular manner, not just one program in a year, which all the zones are doing. In this form, as sir mentioned, then the sincerity per se of assessing, but simultaneously remediation, which Hinal ma'am said. And again, maybe it should not happen just it's a one form like many other forms. And if the various stakeholders are not sensitive at this point, we might lose the sheen which we are currently having with regard to appraisal form. Though my another colleague, Dr. Imon, will speak about some or other pros as we mentioned, but some or other additional cons which we found in this form, and accordingly we need to validate for psychiatry part per se or customize for psychiatry, as Hinal ma'am said. Thank you.
Thank you, sir. It was enlightening to hear the AIMS perspective and the best practices that can guide the institutions across country. And this is another valuable recommendation that involvement of other committees such as PG development is essential for benefit of the residents as well as the faculty. Thank you, sir. Now I may request Dr. Ayman Paul ma'am to share her thoughts. Ma'am, looking ahead, how do you see this appraisal system shaping the future of PG psychiatry education in India over the next few years?
Thank you, Dr. Simran. At the very beginning, I would like to thank Dr. Kishore. Thank you, sir, for taking this initiative. And Hinal ma'am has already excellently summarized everything. So if we look at this form, there's a lot of things that ma'am has already explained. So some of the strengths of this form, if we look at it, are that to some extent it is comprehensive. There are multiple domains. It is assessed longitudinally, and then it encourages faculty engagement and promotes reflective practices, self-directed learning. But the cons, on the other hand, as ma'am also mentioned, that there are lack of behavioral anchors. So as ma'am was giving with specific examples, similarly for even a simple history taking, say, it can be like, rather than saying that this is satisfactory, less than satisfactory, or more than satisfactory, it would make more sense to quantify it. For example, you are observing someone frequently interrupting the patient, and then you see someone is eliciting history systematically. And at the other extreme, you see someone who is very empathetic and the communication skills are excellent. So those descriptors would be more valuable rather than like a generic term, as ma'am mentioned. Also, a lot of new things have come up, like newer competencies have come up in psychiatry, like telepsychiatry, AI, mental health apps. So these domains are somehow not included. So as ma'am mentioned, maybe if we could have a set of EPAs, the entrustable professional activities, make a list of them, like assessing suicidality or violence or comprehensive, doing a detailed MSc, and then rate them over the years, make it year appropriate, and then rate them. That would be more effective. Also, the feedback does not assess what are the specific deficits or the specific strengths of that person, and how you plan to go ahead and rectify that, and when again do you plan, and what do you plan to change in that period. So maybe having that would be helpful. And another thing that we frequently miss is this multi-source feedback we are supposed to do, but somehow we are only observing cross-sectionally when we are seeing the residents. But peer interaction, where appropriate, feedback from the patient or caregiver or the ward staff, that also gives a lot of inputs about how the resident is shaping up as a whole. And also the form does not specifically have anything for assessing the psychotherapy training. So maybe though that also can be incorporated. So as ma'am suggested, that maybe we could work together to better quantify and then develop a set of EPAs which can be used to assess, employ more structured feedback processes, and also quantify that how regularly it will be done. So that is my case from it. Thank you, Dr. Simran.
Thank you so much, ma'am. We truly appreciate your thoughtful reflection. And I also feel that psychotherapy is mostly missing from all these appraisals, and all these feedbacks. So it is an important part and we must add it. Finally, I would like to invite Dr. Bhargav Sai, who joins us today as the voice of our PG residents. Dr. Bhargav, from a resident's perspective, what opportunities do you see in this appraisal form and what concerns do you think department should be mindful of during its implementation?
Good evening, everyone. I'm Dr. Bhargav. I'm a first year resident from JSS. Firstly, a very good evening to all the esteemed faculty members present here. I will be presenting a consolidated feedback from a few postgraduates. At the outset, residents from first, second, and third years of the MD Psychiatry program were asked to review the proposed student appraisal form and share their personal views and suggestions regarding it. The following slides that I'll be mentioning present selected excerpts from their responses. Disclosure, this is exactly in thirds of the PG students who had gone through the appraisal form and mentioned regarding it. I think this appraisal form is a good way to track our progress during residency, as it covers the main areas of training such as academic learning, patient care, professionalism, teamwork, research, and self-learning. These are all important because psychiatry is not only about medical knowledge, but also about communication, empathy, and professional behavior, as stated by a first-year resident. The appraisal form also takes into account responsibility and accountability of the resident, and this ensures that there is ethical learning and practice. The structured scoring system makes evaluation more uniform, and comment section allows for feedback which is more personalized. It tries to advocate to discuss with students so that they can learn their shortcomings and have room for improvement. A third-year resident states that scholastic aptitude domain is particularly valuable in encouraging residents to maintain a balance between clinical responsibilities and academic growth. Another first-year resident states that an area for 6 to 12 monthly self-assessment for the residents may help, along with faculty feedback. Incorporation of a section on resident self-reflection would strengthen the form. A section to assist residents on psychiatry-specific columns like mental status examination, diagnostic formulation, and risk assessment can also be included. What a final year postgraduate had to say. Thank you.
Thank you, Dr. Bhargav. It was refreshing to hear residents' perspective also, reminding us that success of any educational reform ultimately lies in its impact on its learners. So I would like to thank all our esteemed panelists for their insightful deliberations. We will now open the floor for questions from the audience. Participants are requested to kindly post their questions in the chat box or raise their hand.
Dr. Simran, I would like to add one thing is we spoke about the problems with district residency program. I think this appraisal form, if we use effectively, we can capture what the postgraduate is expected to learn from the district residency program. It is the faculty's responsibility to design learning objectives for the district residency program or for the electives for which the person postgraduate has made choice or for the external posting. If the department or the in-charge faculty designs a learning objective, for example, in district residency program, one of the learning objective is that critical evaluation of national mental health policy. That is the objective. So when the postgraduate comes, you evaluate whether the postgraduate has learned that skill, that analytical ability by looking at what he saw, what he or she has seen, then there is a way to put that in this document. Yes, there seems to be a effort made to understand the national mental health policy, whether it is working on the ground. To make it little more effective, they can also ask whoever was supervising their work in those centers can also give a feedback about the postgraduates' work there, whether he was coming or not, whether he looked for some of the things we have mentioned in patient care, did he use the skill which was required. So a person who is supervising in district residency program can also give the feedback, and the in charge faculty of that or the guide, whoever has taken, can make that part of the documentation in this appraisal form, because we should not say that just because the postgraduate is outside the institution, we will not be able to evaluate him. The district residency program also mentions that despite this postgraduate is outside the institution, ultimately it is the responsibility of the teaching institution to make sure that the learning progresses. So I think it is important that we all use this and try to make utility in a way that a postgraduate appreciates that there is a scope for improvement, there is appreciation what the postgraduate is doing, and also to see where we can make changes, because they have left 2 or 3 sections empty, so that a faculty can decide what is that you want to evaluate. So that is another good aspect of it. I think we should try and utilize it. And I think we should agree upon, you should try it at least once in 3-4 months. So at least 3 in a year, so that there is some way to discuss about postgraduate's progress. Even though it looks very simple, and it is what we can say that it does not incorporate many things, for a ordinary faculty who has numerous tasks, the appraisal form which is given is much more easy for him to utilize based on what he has observed, what he has seen, what he has heard, what he has collected. I think in that way, for a faculty who does not require too much of time to think and document something, either he can give the score, or it can also be just saying that you are average, there is a scope for improvement to above average. This is my thing. And obviously from faculty development committee, we would also see how much more we can work with the documents and how good are evaluators themselves. Ultimately, it is our working with the postgraduates and faculty should together we should work to make this document actually useful both in word and spirit. That's one thing. Over to you, Dr. Simran.
Thank you so much, sir, for your perspective. Now moving to the question answer round, I would like to read the comments made in the comment section. Nimisha Desai ma'am, she comments that Delphi study pan India will help to structure the form. Many objective parameters year-wise with defined milestones until achieve basic move further. Changes incorporated by Dr. Heenal ma'am were excellent behavioral markers, entrustment, etc. Summative assessment also needs to be standardized across all institutions. Dr. Heenal ma'am, would you like to comment on this or add to this?
Yeah, summative exams is very difficult to standardize unless we have an exit exam. The exit exam is the only way that we can standardize it. Because if you know, NMC just gives you guidelines as to what should be the way you assess. But it's at the university level which the actual exam setting, paper setting, and everything happens. So all universities will never be on the same page. What helps is when you have an exit exam. So are we ready for another exit exam which is there? I mean, this is one of the things that has been discussed in the past, that instead of the MD exam, there will be an exit exam, and that will be the deciding factor. But You see what happens with the exit exams or NEET exams. It's very difficult. So therefore, technically very good. See, where does it work? Where abroad you have, say, USMLE or something like that, which kind of tells you, or you have board exams, which is, taken by the Royal College or taken by, the associations, then that works. But for our level, one exit exam is the only thing that can work, if at all.
Thank you so much, ma'am. Next, Professor Madhukar Katyar sir is giving some recommendations. Individual quarterly appropriate case vignette based written exam followed by a related combined viva work. Okay, team-wise assessments which should be written and verbal. And number 3, identifying individual resident weakness and strength followed by suggested improvements and later tested again. So these were some suggestions. Any panelists who would like to take on this?
Dr. Simran, as I said, probably this basically means that we are taking up extra information from other sources. That's a good suggestion. You can consider it. But again, it should be in a more standardized form. Unless it is properly standardized, I don't know, we don't know how much value should be given for that. But it definitely gives a scope for getting more information from other sources.
Yes, sir. Professor Madhukar sir also said that quality and caliber of PG is very, very widely between institutes of national importance, government medical college to private medical colleges. So different settings have different quality and caliber of PGs. So what is your perspective on this?
Actually, it's a truth. Nation institutes definitely impart more focused training, and the students themselves are more motivated to learn. When it comes to private colleges, things are slightly different, if not more. Naturally, this is expected. I don't know really how to correct. It's part of the way things move in life.
I would suggest that if there is variation, every institution, every department, I think they are capable of looking what is the standard they expect. And even though we say there will be some differences of opinion, but overall, the faculty should be able to say that this is the minimal requirement we expect, whether it is in patient care, whether it is in communication, whether it is in competencies. And you can then grade the student over a period of time where they need to be upskilled, which areas should be enhanced. I think it is possible, and whether they are in INIs or whether they are in a medical college in rural India, the standard of care we expect, that minimum standard of care is something we all cherish, and that is why there is some consensus on what should be the training, how it should be done, and other factors. So I think it is still possible with the variation to incorporate, because this document does not say that if your student is extraordinary, you do something more. It does not say that if it is very low, you do something less of that. It just allows the faculty and the postgraduate to reflect upon which areas we need to work together, which areas have to be enhanced, which area needs improvement over a period of time. That's one thing. The other thing, Dr. Simran, I wanted to say, we have not incorporated the feedback from the patients uh, in many things, but this document gives a scope that you can also take some feedback from the patients who have interacted or who have been taken care by the postgraduates. How did they feel? That would be an important asset that we consider along with the nursing staff who has seen or psychologists who have seen the postgraduate, or the patient and the caregivers who might have interacted, if they also contribute, then it will be much more rich. And I think we should allow them also to give feedback at appropriate areas so that that can be incorporated in this document. Yeah. Over to you, Dr. Simran.
Thank you so much, sir. That would definitely add more perspective. Um, next, next comment was by Dr. Pawan Kulkarni, sir. He says that I work in a private medical college with PG program. Coming to assessment, I feel assessments are more subjective, and we teachers also do not have uniform teaching methods employed. In that case, would it be advisable to measure or assess every PG with a common instrument? Any of the panelists that would take this?
Yeah, good evening. Under the guidance of IToP, when we did some work in this area, feedback in PG psychiatry. So what we found, the sizable number of the PGs are willing they should be assessed more structurally. And with the existing parameter, we found almost 3/4 of the proportion of the PGs and their respective colleges, there is a program of assessment. Almost some places summative, some places formative, some places both. So in that way, there should be some scale. Again, the guiding authority there is NMC. But unfortunately, what we found, the larger places, assessment is not structured. So how to do, as Dr. Kishore mentioned, some customization at the department to department or institute or college to college level. But at least there should be some beginning. And yes, there should be some relook on the resources as well. As just mentioned, INI, some places resources are more, some places less. But when in the previous comment said that some places, be it private college or some college, we have found and everyone have found that the student as well who tries reasonably hard as an individual level, and they perform much better than even the INI student as well, which we have seen many examples. So, but yes, the resource limitation should also be addressed at the college level, because it is a difficult scenario where just we are assessing, but who is assessing to the department as such? So it's another arm. I don't wish to add the arm per se. So, but yes, the comment is well taken of Dr. Kulkarni. But as Dr. Kishore mentioned, it's a doable step and it has to be taken up at some level. But it was the voice of PGs which we just found in the IToP banner. Yes, it should be, and it is helping to them wherever it is existing. Thank you.
Thank you so much, sir, for the feedback. In the interest of time, we'll take this as our final question. So the question is by Dr. Ranganath R. Kulkarni, sir. Do annual exams help to improve standards with different syllabus every year to learn and be examined? Maybe begin with single paper theory and single case practical exam in first and second year, theory and practical in final year. Now there is only one exam in 3 years. Any of the panelists that would take this up?
So, okay, I'll answer that. Yes, of course, assessment drives learning. It always helps to have exams, especially giving feedback after the exams is very useful. So, how you structure it depends on the resources and number of students. But it can be simple things. It doesn't have to be very elaborate, but even maybe a small questionnaire, small MCQs, or whatever paper. I'm telling you, recently we have started doing from year one papers on a regular basis, because we found that if we started in third year, for 2 years they had not written long answers, and they found it very difficult then to start writing answers. So having regular exams definitely helps in motivating students to study, because it gives them a goal to study, and it gives, and presume that every exam will give feedback, and that feedback tells them what to study and how to improve themselves. So I think it's very useful.
I just
Thank
want
you.
to add that it is also quite taxing if you are doing a formal exam every year. There are not many resources to do that in an extensive manner. As Madam said, if we keep it simple in terms of If the postgraduates need exposure to write a long paper for 3 hours, and if we have programmed or we have given them mock exams at least twice or thrice before they take up, then they would have learned that skill when it comes to writing, what to write, how to write. So I agree, but it need not be annually. But very interestingly, in one of the NMC documents for internal, somehow it was meant that for MD internal medicine, there should be one annual exam at the end of 1 year. So, surprisingly, in some universities, they made it mandatory at the first year, at 1 year, that they have to take all branches in medicine have to take a mock exam, both theory and practical. So you can imagine that department has to work on it. It involves time and all. What we realized is that it helps, provided everybody has time and resources to carry out in the best. And as Madam said, whether you do a 40 marks or 15 marks paper or you're giving 100 marks, if you don't give the feedback, then it is not worth. So that you have to complement it with spending time with the postgraduate to give what needs to be improved, where it needs to be improved, and what is coming out really well. That is something. Yeah. Over to you, Dr. Sundar.
Thank you so much, sir and ma'am. If any of the other panelists would like to add their perspective, they are most welcome.
Just to add where Dr. Kishore left at our institution when we started 2017 PG, the courses started. So then we were given a choice by director to have the assessments yearly or 6 monthly, all the departments. Our department chose 6 monthly since we were having semester system in terms of curriculum. And what we found, just it's a one theory paper every 6 months, just few seconds before Dr. Nimisha Desai mentioned yearly, and Dr. Kishore also said some university. So be it yearly or be it 6 months, but when people know it is going to happen, they also study. We are just having one theory paper, structured practical, and also after the assessment of theory copies and that all, we are keeping feedback session for individual student. So what we found, well, I am stressed that they are going to give the exam after tomorrow or next day, but the students are aware that we are going to give exam, and again they are keeping the writing speed and other organization, as Hinal ma'am mentioned, because we have to nurture that part as well, because it comes at a surprise just at the closure of MD or MS course, and then they are not geared up with this. And as just to strengthen, just before the final MD, we have 1 month before the pre-professional exam, and ditto as just university exam will happen. But the students have welcomed this, and again through their feedback only we have structured this over the years, and it's going reasonably okay. And in connect with feedback part as well, which Dr. Kishore mentioned, that our PG in charge is giving to them, and also handing over the copies as well. Thank you.
Thank you so much, sir. That brings us to the end of audience interaction session. So, thank you everyone for your thoughtful questions and active participation. Your perspectives have definitely enriched today's discussion. With that, we come to the conclusion of this session. So, as we come to the close of today's panel discussion, I would like to express my sincere gratitude to all our esteemed panelists for sharing their valuable insights and experiences. Today's discussion has reminded us that the NMC PG appraisal form is much more than just an assessment document. When implemented in its true spirit, it has the potential to strengthen mentorship, promote meaningful feedback, and encourage reflective learning. I hope the ideas shared today will inspire departments to embrace this initiative, not merely as a regulatory requirement, but as an opportunity to foster the growth and professional development of every PG training. I sincerely thank our distinguished panelists and every participant who joined us this evening. Your presence and active engagement have made this discussion truly meaningful. Thank you once again for being the part of this initiative, and wishing you all a wonderful evening ahead. Thank you so much, sir.
Thank you.
Thank you,
Thank you.
everyone.
Thank
Thank
you,
you.
everyone.
Thank you, everyone. Thank
Thank you,
you.
everyone.
Thank you. And thank you, Dr.
Good night.
Simran, for nicely coordinating the